Hi, I'm Chris Brown. I'm with Abbey Senior Health in O'Fallon, Missouri. Today I want to take a deeper dive into what's known as assisted living. But first I want to clear up some confusing things about what assisted living is and what it isn't. I hear someone say, we had to move my mom into assisted living, but they didn't really move their mom into assisted living, they moved her into skilled nursing. Assisted living has become this general term for all levels of care in senior living, and it's really not a correct way to use the term. Assisted living is actually a level of care, it's a licensed level of care. And so we have independent living, and we have assisted living, and then we have skilled nursing. And so the highest form of care is skilled nursing. The least form of care is independent living. And so that assisted living is the middle level of care that we're going to focus in on today. Why does someone need assisted living? Generally, what you find is that we have these things called activities of daily living, right? We all take them for granted, we do them every day, but when you get older, you have trouble being able to do some of those activities of daily living. And I'm talking about things like bathing, I'm talking about dressing, I'm talking about transferring, getting yourself out of a chair to the bed, out of the bed to a chair, being able to get ourselves to the toilet and up off the toilet, right? Just walking, transporting ourselves around from place to place. And so what ends up happening is that they need help with maybe two or more of those levels of activity of daily living. But for the most part, someone in assisted living is going to get help with all of their activities of daily living, 24 hours a day, 7 days a week. And so there's a nurse that's generally on duty, or a certified nurse's aide, or a medical technician that can help provide medication and medication administration. But all their meals, their room and boarding care, all of those things are generally provided. One thing I want to talk about in assisted living that is a key issue to really kind of hone in on is when someone is in assisted living, well, why can't they just stay in assisted living the rest of their life? Well, they may need help with more activities of daily living as their aging progresses. And the other issue is that in assisted living, it's staffed with less people than in skilled nursing that has a higher level of care associated with it. So in assisted living, someone needs to be able to find their own pathway to safety with minimal assistance in the event of some type of an emergency, like a fire. So someone would need to be able to get themselves out of bed and find an emergency exit if the fire alarm was pulled. And so that's really a distinguishing factor about whether someone can continue in assisted living or whether they need a higher level of care. Maybe skilled nursing would be appropriate. So assisted living is paid out of an individual's pocket. It's private pay. But I will say this, long-term care insurance, which should be a part of everybody's retirement planning, when someone gets to the place where they need help with two or more activities of daily living, usually a long-term care policy will kick in and supplement some of the costs associated with that daily care. It's not paid for by Medicare or Medicaid or private insurance. It's paid for out of pocket. So assisted living generally costs somewhere in the range of about $3,500 a month on the low side to maybe somewhere around $7,000 a month on the high side. It's not paid for by Medicare or Medicaid or other insurance, but long-term care insurance, if you have it, could kick in at this point in time. So assisted living is a great way to get someone some of the basic care that they need. We can see people in assisted living, generally somewhere on average between 18 months to 3 years. And it's a great way for people to be able to live and feel productive and still independent as much as possible. You can be in assisted living if you have mild dementia, and you could be in assisted living if you're in a wheelchair. You just have to be able to transfer yourself to be able to get out in case there would be an emergency, find that pathway to safety. And on the dementia side, still understand clear enough that you could get out of the building in case there was an emergency. At Abbey Senior Health, we have assisted living. We call it Abbey Cottage. We've got a 10-bed unit that's designed specifically for people who have assisted living needs. Assisted living is a great way for a senior to really kind of enjoy their life, have lots of socialization, have lots of activities, lots of connection with other people. And we really find it a valuable form of the care level that we offer here at Abbey Senior Health. Health. Hey, listen, if you need more help, look at abbyseniorhealth.com. We've got lots of educational information there. Hope this video has helped.